Hello, and welcome to this MedCity News webinar sponsored by Mango Health, a division of TrialCard. I'm Stephanie Baum, Director of Special Projects with MedCity News. Today, we're talking about how digital engagement can solve pain points along the patient journey, transforming the patient experience and outcomes. Mango Health is a leading medication and condition management companion app that connects traditional patient support into consumers' lives, delivering frictionless specialty medication experiences. Mango's end-to-end patient-centered support programs combine convenience and choice with branded support services for highly personalized healthcare experiences that improve access and adherence to prescribed treatment. Our speaker today is Yadin Shemmer, Senior Vice President of Mango Health, a TrialCard company. Before we begin, we just have some housekeeping guidelines. For the first portion of the webinar, Yadin will share his perspective of this topic. Then audience members have an opportunity to submit questions to him, and he will do his best to answer most of them. If we do not get to your question, someone from Mango Health will follow up after this webinar. To ask a question, please look for the Submit a Question box on the left side of your screen. And with that, I hand it over to you, Yadin.
Thank you, Stephanie, and thank you everyone for joining us. My name is Yadin Shemmer. I am the Senior Vice President of Mango Health at TrialCard, and I'm excited to talk to you about the patient experience and the patient journey today and how digital engagement can help. Before we dive in to the patient journey itself, a couple of just contextual points. First of all, when we talk about the patient journey, when I talk about it today, I am going to be talking about the portion of the patient journey that begins after a prescription. Obviously, there's a lot in the patient journey that happens before a decision to treat and before a prescription is written, but for the sake of what we talk about today, we will be focused on what happens after that prescription is written. No two patient journeys are obviously the same, but there are a lot of commonalities. And the major steps in the patient journey that I'm going to discuss today are on this slide, starting with a decision to treat and a prescription being written, followed by access challenges of getting coverage and insurance reimbursement. Third, followed by affordability issues and challenges. This is about being able to afford the out-of-pocket expense of the medications. Fourth, starting therapy, so getting through those initial hoops and hurdles and starting the prescribed therapy. And then lastly, certainly not least, is just managing the everyday. How do patients deal with everyday challenges related to the medication, related to symptoms, related to lifestyle, and really get the most out of their medications and get the best outcomes for themselves. At each one of these steps in the patient journey, pharmaceutical brands have set up patient support programs and services, which you can see kind of below. And what I'm going to do is I'm going to talk about each one of these steps. I'm going to talk about the specific pain points and challenges that patients have at those steps related to the status quo, and then go into how digital engagement can actually help not just patients, but also brands achieve better outcomes. So the first step, as I mentioned above, really starts with a decision to treat and a prescription. Patient has gone to their physician. They've either been newly diagnosed or they've been previously diagnosed and just receive a new prescription for their condition. In either case, a decision to treat is made and a prescription is written. And for patients, the existing pain point, the major challenge at this step is what happens next. We all know that time with the physician is increasingly short these days. I think the average time now that patients spend with a physician is under 10 minutes. So the visit is often short. There's just often insufficient time to go into a lot of details. And patients have a lot of questions and they need a lot of help. And they really often just don't know what happens next. In some cases, a physician or the physician's office will enroll them into a patient support program and enroll them into hub services. In other cases, a physician's office may just simply refer to a specialty pharmacy. In some cases, a physician might e-prescribe to a local pharmacy, a retail pharmacy, or perhaps even a commercial dispensing pharmacy for bridge or quick start programs, but it's patchy and it's inconsistent. And often patients just really don't know what to do next. And unfortunately, patient support programs don't have a lot of real estate, if any, in the physician's office or the EMR. And so patients are kind of left on their own to figure it out. And that really is the main challenge for patients. For pharmaceutical brands, the related challenge is that for patients that don't get enrolled and don't find good answers to what happens next, pharmaceutical brands typically or quickly then will be impacted, either because there will be low uptake, drop off before therapy, or even downstream adherence challenges. So this first step of moving from a decision to treat to actually receiving help and guidance along the journey is critical in everything downstream that the patient wants to achieve, but also that the pharmaceutical brand wants to achieve. And in this respect, digital engagement can really help, and it can help by really picking up the baton from the physician's office and making sure that the patient is then pulled through, supported, and provided assistance at all of the kind of pain points and hurdles to come downstream in the patient journey. So for example, what you're seeing on this slide here is the way that a patient support digital program could reach out, enroll patients, get them into a digital platform, and then start an ongoing relationship with them thereafter. So imagine a patient goes to a physician's office. That physician's office happens to enroll them into a patient support program. What is possible to do today is instantly on the back of that enrollment, trigger a text message, for example, to that patient. That SMS will then instantly say to that patient, welcome, we see that you've been enrolled by your physician into this patient support program. Click here to download a mobile application, in this case, Mango Health. Patient can then download Mango Health. They can provide consent. If for some reason they haven't provided all the requisite consents, they can then be introduced to their case manager, and the connection can be made at this step very early on in the patient journey. And this is a way to start patients in a digital platform that can then be a support to them for everything they face downstream. So this is really a way to reach and engage patients at the absolute initial step in the patient journey, and to just avoid any sort of gaps there. We know that the longer that we wait to engage patients after that decision to treat, the more we have, the more there is the opportunity for a poor patient experience and for drop-off. So we want to make sure that we reach these patients early and bring them into a digital engagement platform and a positive experience. Once patients have been enrolled into a digital platform, the next major kind of step in the patient journey, as I mentioned at the outset, is reimbursement and insurance coverage. Today, the status quo is patient will go to the physician's office. They may or may not be enrolled in a hub program. They might just get referred to a specialty pharmacy directly. If they are enrolled into a hub program, they will then leave the office. And what often happens today, the default today, is that patients will just have no idea what happens next. There's this entire machinery in the background that is trying to coordinate with the payer, try to get the payer to approve therapy, but the patient is completely in the dark. They have no clue about how long it's going to take to get the insurance plan to say yes. They have no clue typically what is holding things up, whether a prior authorization is required, whether their physician's office needs to do something. All of that workflow and all of that data about reimbursement is opaque and behind the scenes and is invisible to patients. And this creates for patients a lot of anxiety, a lot of uncertainty and frustration, and often this frustration will simply lead patients to abandon. If this goes on too long and patients just don't understand what is happening, they might abandon, or they might just switch to a different type of therapy. So not a great patient experience and leaves a lot to be desired from a patient perspective. And this is a place where digital engagement can be transformational. And what digital can do in this step of the journey is really illuminate and make transparent everything that has been opaque up till now. So digital platform can provide patients with a tracker like you're seeing on the screen now that can actually show patients all of the critical steps in the reimbursement process, where things stand at the moment, and if there's any sort of holdup or if there's a delay that's related to a specific issue, that that can be made transparent to patient. If patient needs to take any action, they can do so digitally, or if the patient simply needs to go advocate to their physician to take the action that the physician's office needs to take. For example, a form of sometimes physicians will need to file forms of medical necessity or other type letters. Those things are now transparent to the patient, and the patient can be their own advocate, call the office and say, hey, I see this is stuck at this step. Could you please send the paperwork that you need to send? And this type of transparency at this step of the process really, does two things. One, it just gives patients an understanding of where they stand and reduces anxiety. But two, it lets patients know that there's a finish line in sight. And that is critical to avoiding anxiety and just a poor patient experience. But from the brand perspective, it is critical to reducing abandonment. Oftentimes, we will see that there are patients that would have received coverage, but they never made it because they just abandoned before they got there. There are some patients that will just not get coverage because the payer rules are clear and strict, and some patients are not eligible. But there are patients that could have gotten coverage that just tap out. And those patients are expensive to lose. And this is a type of engagement and transparency that can really have an impact on the experience and the retention of these patients upstream. The next major step, the next major set of challenges in the patient journey are related to affordability. So at this stage, decision to treat's been made, patients have been enrolled in a digital platform, they have gone through the reimbursement coverage process, they have gotten coverage, and now they have to go pick up their medications and they're responsible for their out-of-pocket. Today, the status quo is that often the copay benefit is analog. It is not always digital. In some cases, it can live either in the retail pharmacy or the specialty pharmacy. But in some cases, it is still analog and it doesn't travel well. And so we do see some leakage and breakage where patients try to move between pharmacies or switch pharmacies, and they kind of lose or forget their copay information, which creates friction. But the other challenge here for patients is that, again, just like in reimbursement, the affordability benefit is completely opaque today. Patients will have no idea typically how much copay benefit has been provided on their behalf and how much is yet remaining. And because they don't know how much copay benefit is remaining, they often have anxiety about whether they will be able to afford the next fill. And this anxiety and this uncertainty then, of course, results in downstream adherence challenges for brands, and in some cases, even switching. So not a great status quo in terms of what is happening today. And here again, just like in the reimbursement process, digital engagement can play a pivotal role. And the role that digital can play here is twofold. First of all, we can take an analog copay card and make it digital. In other words, that card can now travel, it can live on the patient's mobile device, and it can travel with the patient wherever they go, whichever retail pharmacy they visit or whichever specialty pharmacy they are with at the moment. The copay card can now follow the patient. And that's critically important to avoiding some of that leakage and that breakage that we see. But the second benefit here is, again, the benefit of transparency. Perhaps you're seeing a common thread in the motif here. It is making transparent what has been opaque and invisible. So first, giving patients transparency into how much copay support they have received. Historically, patients have had no idea how much, and brands spend an awful lot of money on copay support. Making that transparent to patients is important to building a relationship and building trust and loyalty with the brand. Second is letting patients know how much benefit they have remaining is critical in removing the anxiety and the uncertainty that patients have about their out-of-pocket. So if patients know that they have hundreds or thousands or tens of thousands of dollars remaining on their copay benefit, this goes a long way to alleviating the concerns that often just keep patients from refilling. So digital can have a real impact here, and and move the needle on experience and on adherence. So once patients have gone through those initial hoops of reimbursement and affordability, the medication can now be dispensed and patients can now start therapy. And for patients at this step of the journey, the key challenge is they have a lot of questions about both the therapy, the benefits, the efficacies, potentially side effects. They may often have questions about administration, especially if it's an injectable, or they might have questions about dosing, no matter how the medication is administered. They just have questions. And oftentimes these questions will result in a poor initial experience with the therapy. And that's a challenge. It's a challenge for patients and for brands, because we know that these first impressions and that first experience with the brand matters a lot to the downstream persistency and adherence of that medication. And so it's critically important for the brand that this goes well, but it's also important for patients that they really understand how they're supposed to administer the med and take this medication so that they get the best outcomes for their health. And today, there's really just this gap in how this works. And to address that gap today, some brands for some therapeutic areas have established clinical nursing programs. And these clinical nursing programs are meant to help patients cope at this stage. A lot of them are focused on administration, how to administer a medication, either remotely or in the patient's home. But some of them are also focused on other elements of therapy and adherence. The challenge that clinical nurses have and clinical nursing programs have at this stage is they just don't have great data on patients. They don't have real-time data on what patient is experiencing, what challenges which patients are experiencing at what time. They don't really know because they're not plugged in to a patient's daily life, and they're left having to rely on kind of outbound calling where they hope to get a patient on the line, figure out the challenges that that patient is having, and then try to help them. So it's really an imperfect system where the nurses in this case are often just flying blind, and they don't understand how to segment patients and how to treat patients and personalize the support that they're providing. And this is where digital engagement can also play a key role. And the critical role here that digital can play is really in understanding the specific issues and challenges that an individual patient is having at this moment in time in order to be able to segment the patient universe and intervene and support in a personalized way. So, for example, we can set up a survey, a digital survey that is sent to patients at this moment in time, and we can ask patients specifically, how's it going? Are you having any challenges? And patient might say, yep, I'm having a challenge administering or injecting this medication, or yeah, I'm not really staying on track with my medication. That can then lead, for example, to another follow-up question of, what do you think is causing you not to take this medication the right way or stay on track? Patient might answer in various ways, but they might say, you know, I tend to take this medication only when I have symptoms, and if I'm asymptomatic and everything is kind of okay, I stop. And based on this type of feedback from patients, we can then determine how to help patients at the individual or at the segment level. So someone that says, for example, listen, I only take this medication when I'm seeing symptoms flare up, it might be sufficient just to send that patient content, an article or a piece of content reminding them that maintenance therapy is important to take on an ongoing basis, even if they are asymptomatic. But for someone who's having more, for example, might be having issues injecting, we might take that information, send that back to a clinical nurse team, and have that nurse then do an outbound call to the patient to help them, or a video chat, to help that patient really understand how to self-inject and stay on track so they don't have issues and just abandon or wait for their next appointment with their physician in a couple of months, which could be too far away. So this is really a way of getting information, getting feedback from patients in real time, and then understanding how we best help each patient with their specific challenges. And then once patients have gotten through all of those initial steps, so they've gotten covered by their insurance plan, they've gotten onto a copay or financial assistance program, they have received their medication, they've gotten through the first dose effectively, and they're ready to go, the big question now becomes, what happens next? What about the next few months or the next few years? How do we support these patients on an ongoing basis? How do we build a relationship with those patients that transcends the hub or episodic copay support, and build a relationship with that patient that can persist for potentially years in order not just to help patients get a better experience and better health outcomes, but also to get a whole bunch of information and data back on the patient journey and on outcomes. And today, there's really no good answers for most pharmaceutical brands on this. The status quo is that patient support today is still kind of legacy web-based. It's more Web 1.0. These are typically still kind of brand websites where patients are forced to go to every once in a while to find various types of support with daily life. Oftentimes, the support that is provided on brand.com, for example, is relevant only in an episodic manner, not in an ongoing way for patients in their daily lives. And often what we see is that patient support programs today are really built in a brand-centric way. So they're built around the medication rather than being built around the patient. And patients have a lot of issues. They're typically dealing with multiple, conditions and comorbidities, not just one. And patients often are taking multiple medications. So from the patient perspective, a support program that is only relevant to a single medication is always going to have limited value and limited relevance versus a platform that can support them with all of their healthcare needs and all of their medication needs. And that's one of the challenges that we've seen in existing patient support programs, and one of the reasons, frankly, why there's low uptake and low engagement with many of those programs. One of the challenges in existing brand patient support programs, beyond the fact that they are typically kind of Web 1.0 based, desktop web or mobile web, is that often they are brand-centric rather than patient-centric. And they're built around the medication as opposed to the patient. And because patients typically will have multiple conditions, multiple comorbidities that they're dealing with, and will often have multiple medications that they're taking, a support program that is limited to one brand, focused on one medication, will have limited relevance and limited value to patients. And that's one of the reasons we've seen some kind of low uptake for a lot of these tools and assets that are provided by brands, and limited payoff for brands. So those are the some of the pain points for patients and for brands with the status quo of helping patients manage the day-to-day, everyday challenges of living with a condition. And in this respect as well, digital and mobile engagement can be a game changer. Mobile tools like Mango Health and others really are providing a daily utility for patients that helps them deal with all sorts of daily challenges with medication and treatment and being able to stay on track with that on an everyday basis, challenges related to lifestyle and activity and being able to do the right things and make the right choices every single day, educational needs about getting the right information at the right time at their fingertips, and all sorts of related support that is relevant to patients on an everyday basis, not a once in a while basis. So, mobile engagement, digital engagement can meet patients where they are on their platforms of choice. What you're seeing today is that those experiences are aligned and look a lot like the experiences that consumers are used to getting in other parts of their life. This type of support is ongoing as opposed to being episodic. It is on the patient's terms, which means patients can access this on demand versus having this information pushed to them. And, importantly, and tied back to what I was saying previously, this type of support is patient-centric. It supports the patient with all of their health and all of their medications rather than being focused just on one specific brand. And that type of value and holistic patient-centric utility can really get a step change in engagement, uptake, and value. And what we're seeing and we're so excited about is by doing all this, by bringing this type of value to patients, by being patient-centric and helping them with all of their needs across the patient journey, not just with a piece of the journey, you earn the right to be there for patients every single day. You earn the right to capture information on patients. Patients will give you information if you're providing them value. And all of that gives you a pretty unique window into patient health and the patient journey. And so what I'm showing on this slide is the type of insight and data that you are able to capture with this type of platform over time. So what we're showing here is an example from the psoriasis patients who have used Mango Health. We can cut this data by condition. We can cut it by therapeutic area, by medication. There's a lot of ways to slice this data, but this is a snapshot of the type of information that you can capture when you have this type of platform in a patient's hand twice a day. On the left in those blue boxes, you're seeing engagement data on this cohort. So these patients are using Mango Health on average 18 times a week, so approaching 3 times a day. Their self-reported adherence is 71%. Almost a third of them are engaging with other features beyond just medication management, and their read rates and response rates to content and surveys that we provide is exceptionally high. And then on the right is more clinical data. So we can see self-reported symptoms and how those change over time. We can see self-reported adherence and how the patient universe is segmented by self-reported adherence. If you look beneath that pie chart, you'll see a histogram there. That is a breakdown of the number of medications that this cohort of psoriasis patients are managing concurrently in Mango. So what you'll see here is that the average patient here is managing around 6 meds, but that there is a long tail here. And there's patients that are managing 10, 15, 20, even 25 medications in Mango. And left of that, you'll see we can double click into that and see the specific medications that are frequent and used in this patient population. And then we can go even deeper and look at what we call medication pathways. So how do patients move between various medications? When they discontinue medication A, what are the most frequent medications that they switch to, and vice versa? And this type of data is not available in traditional real-world evidence sources. So you cannot get this data from EMR, information. This data is often unavailable in insurance claims. This, to us, is the dark spots, the blind spots in the patient journey, which we are starting to illuminate by having patients just give us the information because we're providing them value. And this is the type of information and richness of data that you can start collecting on your patients with this type of experience. So thank you so much for listening and for joining. This concludes my presentation. If there's any, before we go to Q&A, just one last thought. If there's any follow-up, any other questions that anyone on this call has, my email is on this slide. You can also reach out to Mark Droke, and we'd be happy to take questions. Stephanie, do you want to call out some of the questions here that are being asked?
Yes, sorry. Let me just kick it off with a question. What types of products are you seeing the most receptivity for this type of support solution?
So there's really two, when we say receptivity, there's really two, I guess, answers to that. There's the patient and there's the brand. I think from the patient perspective, we're seeing high receptivity across the board. We do see better engagement and better uptake for therapeutic areas which are more chronic and ongoing, and just patients in those categories versus stuff that's acute. Patients with chronic issues are looking often for help in just managing the everyday, managing their medications. There's a lot of complexity there, both in condition management and treatment, but also often with the financial aspect of care. So we see a lot of patients leaning in, but there's no real, beyond that, we don't see that one therapeutic area over another has huge differences. We see a lot of interest from patients. From the brand perspective, we definitely see a lot of interest in something like this from specialty brands. Specialty brands have the highest level, the most issues, the most challenges related to reimbursement and to affordability. And so those brands, as well as, they'll often have issues with administration and complexity in administration. And so patients and brands in those categories are looking for support solutions that are modern and effective, and we're seeing a lot of interest from that part of the universe.
Okay, and I see we have some questions from our audience. First, let me ask of these questions, what are the fears of HIPAA for providers and vendors in using this platform?
So there are some HIPAA issues, but by and large, there are muted, and we don't see a lot of HIPAA concerns in this. So, for example, if a physician is writing an electronic prescription to a non-commercial dispensing pharmacy, all of that prescription information and all of the patient information that is related to that electronic prescription lives in a standard HIPAA universe where the pharmacy is a covered entity and has to treat that information with the same care and sensitivity as they would in any other patient. So I think in that ecosystem, there's really no heightened concerns. That has been going on for a long time. And in the patient support universe, where data is flowing into a hub program and is being captured there, all of that information and all of the vendors that work with pharma behind the scenes, whether it's a hub vendor or a copay vendor or a vendor like Mango Health, we are all subject to the same level of information security and compliance as anybody else. And so we haven't really seen concerns on the HIPAA side be a stumbling block, certainly not for physicians and physician offices, and certainly not with pharma, who are kind of used to working with vendors in this capacity to support their PSPs.
Okay. All right, we have another question. Are there data that you collect in the platform that you don't typically share with pharma?
There's a lot of data that we collect in the platform. Some of that data is just core to what Mango does. It's part of the core feature set. Some of it is data that we're collecting on a bespoke basis as part of a patient support program, either in enrollment or, for example, in the surveys that we provided. So if it is data that we're collecting specifically related to a pharmaceutical program and a patient support program, we make that very clear to the patient, and it is governed under pharma's terms and conditions, which are available to the patient, and it's clear to the patient that that information is going to be used to help support them and provide them more personalized information. For any of the other information that patients provide us that is kind of in the standard Mango toolset, we don't provide that information on a one-to-one basis for pharma typically. Typically, what we will provide is just aggregated, de-identified insights on the patients that are using Mango, similar to the type of aggregated insights that I showed on slide 14.
Okay.
And that's really the way that we treat different types of data.
Sure. So do patients provide consent when they enroll in into Mango?
They do, and consent is critical here. So they're not only consenting to Mango when they come into Mango, that is kind of step one of coming into the Mango application after you download Mango, is providing consent and coming in, but often we will then reconsent them into a patient support program via Mango. So there's kind of a double opt-in and a double consent, and at each step, we're making it very clear to patients what they're signing up for and making the T&Cs available to them.
Okay. Are you seeing any barriers from the patient's perspective in engaging with Mango, or do you generally see receptivity?
We don't see a lot of barriers because what we've done is really try to reduce friction and bring a lot of value to the patient to their mobile device. And I think our value at the end of the day to patients is just helping them manage complexity and doing it in an elegant way on their device. So we're not seeing a lot of friction or issues for patients. It's pretty easy for patients. They can come in, they can get the application, and then there's a whole bunch in one place where they don't have to go to various silos to get information and support. It's all right there at their fingertips, and it's pretty easy to access, and patients can then pick and choose. Some patients engage intensively. Some patients just come in once in a while when they need help, but it's really on their terms, and we're not seeing a lot of barriers at the patient level.
Okay. So are you replacing the hub, or are you service for the hub?
Absolutely not. We are an extension of the hub. Think of us as bringing the hub to the mobile device. I think that's the best way to do it, is we are taking everything that is great about a hub program and then bringing all of that functionality and an extra layer of transparency to the patient's mobile device so that they can get more value from the hub programs that are put in place. We're really turbocharging the investment that brands are making in the hub by bringing a lot of that functionality and transparency to the patients at their device.
Okay. All right, I see we have another question. It is great that you are addressing the problem globally. Are you engaging with each pharma company, or do you engage with the HCP? How do you know the medication that patients are taking?
So we engage with the pharma companies. We work with pharma. They are our partner, and they will select, in some cases, they will select TrialCard to provide hub services or copay services, and in some cases, Mango will be part of that, or in some cases, they might just choose Mango as a standalone platform for patient engagement. And through our work with pharma, we then touch the physician's offices as well. So for example, when we're working with a pharmaceutical company and brand that have a hub program in place, that hub is getting information every day from physician offices. They're getting enrollment forms that are being sent in. And so we use that touch point to capture information and to identify patients who have been prescribed. That's the way it typically works.
Okay. Are you able to conduct things like injection training, nurse training to patients via Mango?
So today in Mango, we're not doing televisits or video chats today. That is on our roadmap, and we will do that, I think, in the next kind of 12 to 18 months, where we will literally be able to facilitate an injection training or a clinical nurse conversation in the device. Today, what we're doing is really just enabling the clinical support programs to understand which patients need help at what time. So if a patient says, I'm having an issue injecting, they answer a survey like that, we're getting that information instantly to the clinical team, and the clinical team can then choose what to do with it. We might say that, hey, the first thing we're going to do is send a video to that patient in Mango. That we can do today. We've been doing that for a long time. We can send a video to that patient that is an injection training video. Or we might also say, hey, let's make sure that we call this patient and help them with injection. So we're really acting as a triage tool to help the nurses figure out which patients to support at what time.
Okay. All right. All right, here's another question. What are some of the obstacles and challenges that pharma should be aware of when thinking about integrating a solution like Mango Health into their support ecosystem?
There's a couple. The first is that if a brand has multiple patient support vendors in different places, so let's say a brand has a hub with a specific vendor, a copay program with another vendor, a clinical nursing program with a third vendor, one of the challenges is making sure that the experience, the digital experience that I just walked through, has all of the components that we want for reimbursement, affordability, medication management, and ongoing kind of support baked into it. And that requires a vendor to go integrate with all those different vendors. And that can take time and it can be complicated. So one of the things that pharmaceutical brands should think about is whether they want to centralize a lot of their patient support services with one vendor in order to make it easy to stand up these digital experiences that are rich and powerful. And then the other thing is, if it's not set up that way and it is disjointed, is just making sure that the brand is realistic about the time and the effort that it's going to take to integrate all of those different pipes into a digital experience like Mango. So that's one set of challenges with building an experience like this. The other, which is common to kind of anything digital, I think, is the MLR PRC process. Making sure that the compliance teams at pharma see what's happening, understand exactly where in the experience the brand is appearing, and making sure that that anything on those parts of the experience is approved. That takes time, and I don't think it's a barrier in terms of getting through. It's just a time constraint, and people need to be realistic about that. And then the third, I think, key challenge is, at the end of the day, once you've built it, making sure that you can enroll patients. That is a critical point, and really our perspective on that is the most important thing you can do, first and foremost, is leverage the existing touch points you have with patients. So making sure you can leverage the non-commercial dispensing pharmacy, making sure you can leverage the hub and all of the activity and the conversations that are happening at the hub, making sure you can leverage all of the patients that are signing up for copay programs, making sure you can leverage the brand.com touch point and any patient that's hitting that. So really looking holistically at all of the touch points that a brand has with patients and using those as on-ramps to bring patients into a digital experience. That needs to be thought of ahead of the program so that it can be successful and generate scale.
Okay. And just a reminder to our audience that to ask a question, please look for the Submit a Question box on the left side of your screen. Let me ask another question. What types of compliance questions tend to surface most commonly in medical, legal, and regulatory reviews, what's referred to as MLR reviews?
Yeah, a lot of the stuff I was just talking about. So sure. Often we will get, the most common question is, you know, are there any claims being made next to where my brand is shown that would create an issue? Are there any potential, and second I would say is, are there any potential adverse event issues that come up or arise from having a tool like this? Those are the most common, and so a lot of the MLR process will focus on going screen by screen through this experience and looking at where the brand is present and making sure that the MLR team is comfortable that no claims are being made around that brand and that everything is compliant. Second area that we often see is adverse event concerns. Typically those concerns are the most heightened when there is free text. So, you know, if a patient can enter any sort of free text in, or if patients are chatting in some sort of community and they can talk about a specific medication and critique it or say they've had side effects, that will often trigger you know, a PRC, a pharmacovigilance review, and we see pharma focusing a lot of that. And I think the third level that we often, you know, see MLR teams focus on is simply consent, and that ties back to a previous question that we got about, you know, consent. Do you have the requisite consents, et cetera, et cetera?
Sure. Okay. And apologies if you've already touched on this question, but how have you successfully partnered with customer relationship management agencies that also provide similar content to on-brand patients?
Excellent question. I think it's really been a fruitful partnership with a lot of the CRM platforms and vendors that are out there. We really see it as a two-way partnership. Number one, we can send a lot of data into a brand's CRM partner or into their data aggregation platform of choice. As you saw in the previous slide here that I showed, I'll just click back to it for a second. We're capturing a huge amount of data on these patients, data that is impossible really to get anywhere else, or very hard to get, I should say, anywhere else. And we can take a lot of this data and we can feed it into a pharma company's CRM to help them segment their patients and better understand their patients for market research or real-world evidence type analysis. Number two is we will often get from pharma CRM partners or brand teams, we will often get from them both the way they think about segmentation, so which are the typical patient segments that they've identified through their own work, as well as we can get content from them and maybe just a rule set. And so Mango cannot, Mango or platforms like us, we can be a brain that is feeding back data to the CRM, but we can also be a muscle that is then actioning insights and segmentation to engage patients the right way at the right time.
Okay. Where do you see the biggest opportunities for platforms like Mango Health as you look ahead to the next 12 to 24 months?
I think the opportunity, the big opportunity for us here is to become a holistic, integrated platform that really supports patients with all of their needs across the entire patient journey in one place, and B, to become the connective tissue between not just the patient and the patient support program, which is what we've done here as a step one, but longer term to become the connective tissue between the patient and the other parts of the healthcare ecosystem. So how do we connect not just to the PSP, but also to the patient's provider, and then ultimately also to the pharmacy, and be able to send data back into the EMR, be able to give physicians real-time information on their patients, and also be able to connect into the either specialty pharmacy or retail pharmacy to facilitate dispensing, refills, et cetera, et cetera. So we see ourselves down the road as really being that central nerve center, that command center for the patient, which helps them to get the most out of their health, but also to engage and interact with the entire healthcare system.
Okay. And I was just wondering, do you have any kind of final thoughts that you'd like to leave our audience? Any takeaways that you hope they take away from this discussion?
Yes, thank you, Stephanie. Well, first, just a thank you for anyone that stuck around this long and for joining us. Two closing thoughts. One is a lot of the stuff that I just shared today used to be considered a couple years ago fantasy or kind of very far away, distant, hard to achieve. It is a reality, and I would just stress to folks who joined us that this is no longer impossible. This is happening today, and these are the type of experiences that you can bring forward to your patients today if you work with the right partner. And two is, I would say, a lot of this type of work has historically been considered part of the innovation team or the innovation budget. And what I would stress to brand marketers, to patient support leaders, to anyone else who is thinking about these things today is this is no longer a nice to have, this is a must have. Patients are spending 5 hours a day on average on their mobile devices. And if a brand doesn't create a compelling experience that lives on the mobile device where patients are spending this much time every single day, brands are just missing out on a huge opportunity to create a better experience, to create better loyalty, but also to impact a lot of these outcomes that we care so much about in the patient support world. So with that, thanks again, and happy to chat offline. Feel free to reach out on the email addresses that are provided here.
Okay. Thank you for listening to this MedCity News webinar on how digital engagement can solve pain points along the patient journey, transforming the patient experience and outcomes, sponsored by Mango Health, a division of TrialCard. This presentation will be available on demand later today. To view it, please use the same link found in your registration confirmation email. Thanks to our speaker, Yadin Shemmer. Thank you to Mango Health, and have a pleasant day.